Hello friends, today on my channel I have a very special guest who has played a very critical role in the successful journey of thousands of pregnant women. From my viewers from Mumbai, especially from Navi Mumbai, Dr. Meena Srikanth does not need any introduction. Dr. Meena Srikanth is a senior gynecologist practicing at ABMS Hospital. She is also associated with Apollo Hospitals, Belapur and Motherhood Hospital. Dr. Srikanth is an MD, DNB and DGO from KEM Hospital, Mumbai. Welcome, Dr. Meena Srikanth. So happy to host you today on my channel.
Okay. Thank you for your kind introduction, Sujal.
I'm sure you all might be very skeptical or having doubts on what to do and what not to do. So let's clarify from the expert herself. So welcome, Dr. Meena. And today we'll take up a few questions. So starting with the first and a very common myth among the ladies is that since I'm expecting, do I have to eat double?
See, this is a very wrong notion that you should be eating for two. This is a very wrong myth because that makes the lady feel guilty if she's not eating enough. And finally, she hogs a lot and puts on a lot of weight, which is not going to be helpful for the pregnancy. In fact, if the weight is too much, it can be detrimental to the pregnancy. They end up with high BP, high sugars in the later half of pregnancy.
Oh,
so yeah. It is absolutely a myth.
Right. So she must eat just to take care that the nutrients reach the baby and not the fat portion. So
yeah, it has to be a balanced diet. She cannot starve herself to just maintain the weight, but it should not be a hogging just for two. No, that is a myth.
Right. Okay. Now, other very common myth is that should I eat more of ghee in my diet to have a normal delivery?
Yeah, this is a very common myth among patients which we see.
Yes.
The problem here is, see, our tract, our reproductive tract is a separate cavity. It's not associated with the bowel. So obviously what you the ghee or whatever slippery substance you eat is not going to reach your vaginal mucosa where it is going to help in the slipping of the baby. So again, that is only going to increase the weight of the patient, and they come up with a lot of back problems and other things due to obesity, due to ingestion of such excess ghee.
Right. Yes, this is a very most important thing, that the path of both things is completely different. So we must not focus on eating so much of ghee, but normal ghee that is required for the body.
A normal diet and a normal inclusion of ghee is okay, but excess ghee for pregnancy is not recommended.
Is not recommended. Yes. And yes. Now moving on to our next question is, yes, people, ladies fear that they will form scratch marks or stretch marks on their stomach. So should they apply vitamin E oil or cocoa butter oil or something to be applied that will, so basically it is like, will something help them to prevent their scratch marks?
Okay. So this is a very important question and a significant one which you've asked me. Right. This is again a problem. Like I understand that every woman is worried about the stretch marks, but when we talk about applying something locally, it is not going to solve the problem completely. So, and another myth which is included in this myth is when you scratch the skin, that is what causes the stretch mark. Okay. So now what they have to understand is whenever you apply a cocoa butter or some other anti-stretch creams, what it does is it acts as an emollient. It moisturizes the area. It decreases the itching for a short while, but it may not stop the stretch mark from forming, because stretch marks are formed depending on the elastic fiber amount in your skin. So if the lady by birth has more elastic fibers, even with the stretch, she may not have a lot of stretch marks. Whatever she applies, so she doesn't apply. But if the elastic fibers are less, they break in the skin and cause the stretch marks. So you can apply the emollients only to give you relief from the itching, but the formation or not formation of the formation or having a good skin is not dependent on what you apply locally.
Yes.
So if we know the truth, then probably they won't be disappointed. And sometimes, again, when they start applying, they go vigorously applying it over the abdomen with so much pressure, thinking that would help in avoiding all stretch marks, and that only is going to be more harmful and cause labor pains before time.
The abdomen has been expanded. So after delivery, then the skin subsides. It has to again go into reshape and stay what it was normally. So then what remedy would you suggest?
See, you being a yoga expert must have seen a lot of females with loose skin and a loose muscle. So these are two different
Yes.
entities. When you talk about loose muscles, it is the muscle which has become loose and lost its tone, basically.
Hmm.
So that would
Right.
actually cause the abdomen to pout out when they are sitting or standing, and it will go in when they're lying down. That has to be
Right.
rectified. Okay, so that I think with exercises, especially with experts like you, they would be able to do it post delivery. But the woman has to concentrate on it and just not keep talking about it. They have to actually go and do it. So that actually helps them.
Exactly.
Yeah, that helps them in toning up the abdomen. But coming to the skin, the loosened skin is a bit difficult to treat as such with just some ultrasound or with just some creams, because it's almost like the sagging skin with age. Like you can see certain age marks on the face, but there's a sagging. Okay,
Right.
similarly, the stretched skin cannot be put back to place easily. There are some lasers which people do suggest may help to some extent, but the only thing which helps completely or to a large extent is the plastic surgery. But I think not everybody would opt for it. So I think
Right.
even if the muscles are toned back, it gives a better shape to the abdomen.
Right. So
And there is
probably yoga and exercise would help them to get back into
absolutely,
shape. Yes.
absolutely, and every woman should do it to tone back her muscles, because that not only helps in the cosmetic purpose, but also to give a strength to the back.
Yes, so yoga or exercise you can't skip, whether it is before pregnancy, whether it is during pregnancy, or whether it is post pregnancy, as we have heard from the doctor herself. Yeah, so moving on to the other question is, can I drive a four-wheeler in pregnancy?
See,
Yes.
so this is again important. So when you restrict yourself unnecessarily, that creates a negative impact on you for future. So you hear so many people, they don't want to go for a second pregnancy after the first one because they will start from doing so many things unnecessarily. So you can drive, but then you don't start your driving classes in pregnancy. That is what
Yes.
I would say. So if you are already driving and you're doing a
Driving.
good job, yeah, so you can continue driving safely with your seat belt and just adjust the distance between the wheel and your chair.
Right.
And since you are driving your vehicle, you will be more cautious about not going speeding up or going over a speed breaker erratically, right? So it is not a
Right.
contraindication to drive in pregnancy.
Yes, yes. So if you are already driving before, so you can very comfortably drive during pregnancy also. And since the gear and the brakes are in your hands, so you would be a better judge on when to apply the brakes and how much to
Exactly,
go.
exactly. And women are
Yes.
such careful drivers. I think it's a myth again that women are bad at driving.
Yes, yes, yes. Very true, very true. Can I fly during pregnancy? Plane,
Yeah,
flight? Yes.
yeah, absolutely. There is no contraindication to flying in pregnancy. The flight per se is not going to affect your pregnancy. Just that you take care that you hydrate yourself well, and that's a general rule for anyone who is going on a long flight, but more so
Okay.
in pregnancy. And if you're pregnant, I think even the crew ensures that you get a seat where you can actually stretch your legs if you need to.
Legs. Yes, very much. Is it true even during the first trimester, the first 3 months?
Yeah, no problem. It's just that travel anywhere, whether it be flight or road or your railways, you should ensure that the heartbeats have appeared in the pregnancy and then travel. Not because of the travel,
Right.
but if you don't know whether the heartbeats have arrived and if there's a problem with the pregnancy, you may start bleeding, and that can be a problem for the
True.
traveler, for the patient. But
Patient. Right.
otherwise, a flight is not a contraindication.
Right. Exercise safe during pregnancy, because as we have addressed in earlier questions also, no doubt this question would be addressed, but still people have myths that whether we can do exercise or not because baby is in the womb. So exercise would
Um,
affect the position.
no. Exercise, in fact, is advocated in pregnancy. Okay, the only place where we say don't start with your heavy exercises is in the first trimester, where
Right.
I think even you must be aware that even in yoga, we don't advise in the first trimester, we only advise breathing techniques in the first trimester when the baby is just trying to nide in the uterus. But
Yes.
the other exercises for flexibility of the pelvic floor and for proper birthing later, I think it is a must unless it's contraindicated for certain conditions where the patient is already going into a preterm labor or say there is a bleeding going on or the placenta is embedded in the lower segment. In such cases, we don't ask them to exercise or do exercises which increase the abdominal pressure. Even then they can exercise, they can do the deep breathing, but any other exercise which would aggravate the bleeding or the cause is contraindicated. But otherwise, it is a good thing to practice yoga or exercises from the
Exercise.
second trimester onwards.
Right, right, right. Okay, yes. And another question, the sleeping position. What is the right sleeping position during pregnancy?
Yeah, this is another trouble for most women because we advocate that sleeping on the left side is always good for the pregnancy
Right,
because the blood flow is better for the baby while the woman sleeps on the left side.
right,
But being a human, it is not possible to be on the left side throughout the night, to be
night,
in the same
yes.
position throughout the night. So people either take it too seriously or too lightly. So we
Hmm.
want a mediocre approach to a medium approach to the whole thing. So they should be lying on the left side as much as possible. And whenever they want to change the posture, they can go to the right side or on their back for a short while and again go back to their left side.
How much is the ideal weight a lady should gain during her pregnancy throughout?
A lady who starts with an ideal weight, again, each one doesn't start with the same weight when they start their pregnancy.
True,
A lady who
yes.
starts with her ideal weight would gain around 11 kilos on an average, 11 to 12 kilos for an Indian woman throughout the pregnancy till their ninth
Okay,
month. So that
right.
would mean around 1.5 to 2 kilos per month. That is the
Yes.
average. But you generally see that in the first 3 months, women do not put on weight because they have a lot of nausea. And also the baby is not gaining so much weight. It's a small little baby. Okay. So,
Right,
but post that, they do compensate and they do gain weight, and that 11 to 12 kilos is okay. But if the lady is already obese when she starts her pregnancy, her BMI is not ideal, then we
right.
don't advocate 11 kilo or a 1.5 to 2 kilo rise per month. For them,
Okay.
even a small gain and maybe a 4 to 5 kilo gain is okay if she starts her pregnancy with a higher weight.
Right, right, right. Can I take COVID vaccine in my pregnancy? How safe it is for me as well as my baby
This is the commonest question which we are coming across nowadays.
nowadays? Yes.
Yes. Even for a non-pregnant, there was a lot of resistance among the population to have the COVID vaccine. But luckily, since so many of our Indians have taken it, people are comfortable having it. But again, with pregnancy, this question comes up to us. So actually, COVID vaccines, which we have seen in our patients, are absolutely safe. None of them had any problems, and not only with me, even with my colleagues, whoever have been prescribed a COVID vaccine and whoever gone and taken their COVID vaccine are doing well. With Covishield, probably they would have a short duration fever of a day or two and nothing much, maybe a little body ache during that period. And always when you look at vaccines, you should always look at the risk benefit ratio. So a
Right.
COVID infection in pregnancy is much, much dangerous. It can cause preterm labor. We have seen people coming with intrauterine deaths, and we have seen people with losses. We have seen people with high BP post-COVID. There are so many things which can happen post a COVID infection. And compared to that, the COVID vaccine is very useful. And I think every woman should go ahead with it. And Covaxin being a killed vaccine is so much more safer in pregnancy.
if I had my C-section in my first delivery, in my second pregnancy also, are there chances of normal delivery, or it is said that first is a C-section, so second has to be a C-section?
Okay. So again, there are certain indications which are absolute indications for a second section. Okay. And there are
Right,
certain indications where it is a relative indication for section where a trial can be given. So now it depends on what was the reason for the first section. Some people
right,
have a contracted pelvis, and you must have seen that some have done the maximum exercises, they have tried their best, but still end up with a section for a different reason, that the pelvis is too contracted, they are short, or maybe the baby is big for the pelvis. In such cases, it depends on what the weight of the baby is at term, at the time they're going to deliver. That would decide
right,
whether they would be having a section or not. Or if the placenta is covering the os, then you just can't give a trial. It is
right,
bad for both the mother and the baby. So leaving that, if the patient goes in labor by herself, or if the pelvis is fine and the other parameters for the baby and mother are fine, or trial can be given for a previous section. That's not a contraindication.
we had a very good conversation with Dr. Meena Srikanth. Thank you so much, Dr. Meena Srikanth, for spending your valuable time for us and giving us the most useful tips and advices. So, my lovely ladies, I hope all your queries regarding pregnancy have been addressed. If you're left with any query, still do let me know in the comment section below so that we can address them as soon as possible. I'll see you in my next video. Till then, take care, stay happy, stay safe, and keep practicing yoga with me.